I use a tool like this and I get into the hip, and most of the time this treatment is not comfortable at all. So so her problem's right here, and I can feel that there's like a little bit of a bump, and this bump, without doing x-rays or MRIs or anything to see where exactly I'm at, with palpation wise, it feels like I'm right over the hip joint. And there's typically a really annoying small spot, and it's possibly the size of this little tool, is where the irritated area is. But what's interesting is if you can get this little, and I'm not moving around a lot, it's just this one little spot, and it's in a different location on each person. You just have to kind of know how to feel for it. But you just go back and forth a bit, and you just try to get this thing to calm down. It's excruciating. It's not a fun pain. It's a very annoying thing. But what I found is this simple technique will calm the whole hip down. And so she actually has a lot of tightness in the posterior hip. So all the hip muscles in the back of the hip are really, really tight and bound up. She has tightness in the quad. Everything's just tight around that hip, and it's just, that's the way she's trained. That's the way the body has learned how to function. Oddly enough, working on this one particular area, we can get shift and change. And so immediately there's a freedom in the leg. So now I can take her and I can start pushing her, and she can make it past 90 degrees before she starts to shift out. She still shifts out, but it's a different feel. There's a less of a resistance in her hip. Now, if I take her to inner quadrant, she actually can go there now. And I'm not really pushing hard. But what's interesting with the inner quadrant is going to be, she has a new barrier, a new boundary. I can still cause pain at the new boundary, but she can actually move a lot more. And that's all I'm looking for. And then lastly, this improves dramatically. This is actually more what a 20-year-old should have rather than what she was presenting earlier. So this is on the anterior hip that I'm working, and it just takes some palpation.